Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome everybody to this very spontaneous, very much needed live session with me online today. Jazakumullah khair for everyone that's here. Let's all start with our dua as always. Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una wa zidna ilma. May Allah make this session beautifully beneficial for each one of you that is here today. And I hope I'm able to answer as many queries that I've received as possible. But subhanAllah, the number has been huge. So I will definitely go through the most common ones and the most asked ones. All right. So yeah, Jazakumullahu khair. Thank you, everyone. This is going to be a very live Q&A, and I'll explain what's going to be happening today. And I have a lot to share today as well. All right. And this session was actually inspired by my moms, subhanallah, the mothers that I work with. The last 2 weeks, let me start from April. So basically, let's start from Eid. So after Eid, lots have been happening, alhamdulillah, and in the birth world. And I have been helping Amani Birth, and I'll introduce them in a bit as well, with putting together a tour that was very successful in Pakistan, alhamdulillah. I was doing all the virtual stuff. And then at the same time, I was teaching my classes as well that I always teach. And then, subhanAllah, attending some births. So yes, if the timing kind of matched, so I have been back in attending births at the labor room, which I wasn't doing since my last one was born. And now, alhamdulillah, this last week has been a birth week for me. There have been 9 babies, subhanAllah. And that's a huge number if you look at it, from my blessed mamas. I call them blessed mamas because they are the ones that have taken classes with me. And every single one of them has been super, super, super duper empowering. MashaAllah, alhamdulillah. And there's been VBACs. There's been 1 VBAC after 2 C-sections, and all over the world. So there've been some in Kuwait, some in India, some in Pakistan, 1 in the UK, 1 in the US. It's like a global thing. So thanks for the online platform for us to help moms reach in this matter as much as possible. So I thought that I do want to share some tips. At the same time, I was like, let me thank Allah subhanahu wa ta'ala, of course, with salat al-shukr, but at the same time, let me thank by doing something for the public. And that's why I put together this quick 1-hour session that I could squeeze in my schedule, alhamdulillah, today. So yeah, let's start with our intention. So always, innamal a'malu binniyat. So always start with the right intention. So all of us sitting here, let's renew our intentions that we are here today for the sake of Allah subhanahu wa ta'ala, so that we learn something that help us as mothers, as fathers, as hopefully children, like for our children as well. Those of you that are not married, for your future life as well. Those of you that have sisters-in-law, for your daughters. May Allah make it beneficial so that we empower and educate and support the women of this ummah through this precious sacred time of childbirth, breastfeeding, and beyond. Alhamdulillah. So yeah, I want to thank, first of all, each one of you who's here listening to me live. I know it's hard to take time out, especially when you're busy and stuff. So a special thanks to all of you for that. All right. I'm going to start by introducing myself because, mashallah, there is a big, big, big number of people that are new, that don't know me, probably, right? So my name's Hafsa Qureshey. This session is going to be in English, by the way. I will be doing another one in Urdu and another one in Arabic, hopefully sometime next month. All right. So my name's Hafsa Qureshey. I am a mom of 3, Allahumma barik, alhamdulillah. And my first birth was a very traumatic C-section. And since April is a C-section awareness month, I wanted to talk a little bit about that first. I do have a free event coming up on C-section recovery with Anna. She's been my physical therapist here in Kuwait. So that's coming up on Wednesday. So those of you that are in my WhatsApp group, I've got 2 WhatsApp groups for events and announcements. So you're going to get a lot of tips, and we are going to share mutually. She has been a natural and a C-section mom, so she's got lots to share as a professional as well. So that's coming up on Wednesday. I'll share about it in the end again. So don't leave those groups. Yeah, there's lots coming up, inshallah. So my first was a very traumatic C-section. Now it's going to be almost 16 years. But I'm thankful for that C-section. I recently did an Arabic podcast with Dua, and that's the title I put, Why I Love My C-section. Because had that not happened, even it was traumatic, I would not be here sitting and talking to you today. So that is one event of my life, which if someone asked me what was the worst of your life, that is probably one event that I hated and that I carry trauma from. But then that is one that made me what I am today as well. So once I experienced that experience, I was like, no, this is not how it's supposed to be. Let's get the right knowledge. And then alhamdulillah, I found an amazing organization here called Birth Kuwait, and this is back in 2011. And that's when I joined them as a mom, and I educated myself. Took multiple times, not once, multiple time birth classes, dragged my husband into it, dragged my mom into it, and mostly myself, did regular prenatal yoga. And alhamdulillah, after shopping for 18 doctors, I changed 18 care providers, and still didn't find anyone 100% supportive, but that's fine because I had the knowledge. I achieved a VBAC, which is a vaginal birth after a C-section, in 2013. And that's when everything changed, subhanAllah. So from 2012 until today, this is what I've been doing. I've been educating myself, helping others, supporting others. And then once I achieved my VBAC, Birth Kuwait, mashallah, they bring all these international organizations here. I managed to do all these certifications that you can see on the screen. Shall I read through them? Okay, so I'm certified from Amani. Amani Birth is the key thing that I'm going to talk about today. So Amani is assisting mothers to help them achieve active, natural, instinctive births. And it's the only childbirth education program in the whole world that is Islamic faith-based. And that's why I love it, right? And it's my favorite one to teach. And I've been teaching it online since almost when it was launched, the COVID time, all right? And in person alongside, but I prefer the online. And I recently became the advanced certified childbirth educator with them. I'm also certified from Lamaze, so I'm an LCCE, Lamaze Certified Childbirth Educator. That was one rigorous training. Because I'm so passionate about VBAC, so vaginal birth after 1, 2, 3, 4, 5 C-sections, I've helped moms with all those. I became certified as an advanced VBAC doula, certified as advanced VBAC, as a VBAC support practitioner. And then I was very passionate about lactation, about breastfeeding. So one of the first trainings I did back in 2012, was it? I can't remember now. Yeah. One of the first trainings I did was, no, it was 2014, was to become a breastfeeding counselor and lactation educator by WHO, UNICEF, and Birth Kuwait. And then I became a certified lactation specialist and now a certified trainer. I train new counselors now. And we have a training going on now. And on Thursday, I will be at the hospital doing clinical skills with them. I also became a certified newborn care specialist, specialized in biomechanics of birth to help understand the alignment and how things work. I am now, alhamdulillah, I'm so blessed to be an executive assistant of Amani Birth, so handling lots of things behind the scene, the technical stuff, because my original degree was a major in software engineering. And then I am also the executive board member at Birth Kuwait here, and the CEO and founder of my own Hafsa Qureshey support and services that I have been. I was thinking of lots of names. I'm like, people know me as me. Khalas, if I'm launching something, let's just have it there. So alhamdulillah, this is what you see on the screen about me. So yeah, it's been a journey. And in the last, like I said, 13 years, I lost count. There was a time I was keeping count. After 1,000, I stopped counting the number of moms I've helped, whether it's natural birth, whether it's breastfeeding, whether it's VBAC, multiple C-sections, empowering C-sections, all of them. So and then I had my second VBAC in 2017. So this has been my journey. What are we going to be talking about today? So discussion, question and answers on pregnancy, on birth, labor, breastfeeding, newborn care, VBAC. So all my qualifications that you saw, exactly those are the related questions that I've received on that link that I posted on the WhatsApp group. So I really hope if you didn't get a chance to post your question would pop up in one of the questions that have been asked, because many of them were very common, like repeated questions. Okay, so I hope, inshallah, I get to answer those. All right. Okay, so before we start the Q&A, I'm just going to go ahead and share a few of the birth stories in the last 5-10 minutes, very briefly, You can find detailed birth stories on my Instagram. I post them now and again. Recently, because it's April, I posted when dear mama, sister, family member of, like, I consider her family, honestly, her empowering C-section she had a couple of years ago, and subhanallah, last week she achieved her VBAC birth as well. So it just felt so celebratory to share her story, which you can find on my Instagram as well. That yes, even C-sections can be so empowering, right? And we should support mamas at every point, every stage, every journey of their life, regardless of what the outcomes are. Because the outcomes of birth, of course, it's ilm al-ghaib. Only Allah subhanahu wa ta'ala knows. What we do, our part as moms, as someone who's been given this mas'uliyah, this responsibility to take care of her child, is to nurture it, to educate yourself about it, to give it the best, to mitigate, reduce risk factors, and provide our child with the best blessed start into this world. So the taking care part of your child does not start after they're born. No, it's happening now. So if you're pregnant, subhanallah, you're already responsible for this child. Anything you eat, any medication you take, anything that you expose yourself to, anything that's harming you mentally, emotionally, all of this has a direct impact to the little baby. I have little babies here. I have props and things that I hope to use. This little baby is counting on you, right? This child inside you is counting on you to make the decisions. The child outside you, if you're breastfeeding, it's counting on mama to take the right decisions, right? So it is a big responsibility on us as parents, especially the mother, when she's nurturing her child, whether it's pregnancy or breastfeeding. So starting with the birth stories, if I think of it, one of the first, so let me go back last week. So last week started off with first time mama going into labor, very textbook kind of labor, and mashallah, she labored at home. Then her water broke, and she knew, because she had taken the classes with me, that you don't rush to the hospital if the water breaks, following the water breaking protocol. Alhamdulillah, within, I think, the total of 7 to 8 hours of labor, she gave birth. Allahumma barak, and this happened here. I had another mom that I attended her birth, alhamdulillah, here in Kuwait. Her labor was much longer, almost 22 hours. I joined her in the middle to give her husband a little break. And then, alhamdulillah, she had a natural birth. And then we move on to this mama that I met. No, well, there were two together. So a mama in India and then a mama in Pakistan. Both of them were VBAC. So one was VBAC and the other was a VBAC after 2 C-sections. All right. And both of them had very similar starts to their labor. Allahumma barik. And that mom that had, both of them, their water broke earlier, right? The one who had after 2 C-sections, her water broke, I think, around 3 to 4 days earlier. It started to leak. Again, same protocol applied. She kept a check. She was not waiting blindly. She was not putting herself at risk. Lots of consulting me whenever she needed. I kept guiding her, reminding her of what she had learned, because of course at that time a mom can be overwhelmed. So I always tell my mamas, my support does not end with the classes. Once you educate yourself, you will join my support groups and you will get support whenever and however I can answer. And like my husband was telling me, your phone is in your hand 22 hours. So if a mom misses out on you in those 2 hours, she would be very unfortunate. Well, I don't think so, but let's see. He was joking. Alhamdulillah. So so alhamdulillah, she was replenishing the fluids like I had taught her. And then her labor started. It started to progress. Meanwhile, I was the other mom. Her water broke, and then her labor started immediately. The other one, it started after 3 days, which is completely fine. And both of them were laboring at the same time. It went all on that day. The night happened. Things picked up in the night for the VBAC mom. And then in the morning was very adventurous. She goes to the hospital, goes back, then goes in ready to push, and then she has her baby. At the same time, I get news from the mom in India after 2 C-sections that alhamdulillah, I did it as well. And uh, it was a moment of very much emotions for me, because last I had heard her was from the morning. I was not in touch with her. I was just waiting for her news, but she had consulted me and we were going through it. So, mashallah, these were two other births. And then I got a break for 2 days before I got another message that of contraction app. So they timed, as I tell them apps that they use, they take the time on it, and then they send me screenshots so we can kind of see if it's real labor, if it's Braxton Hicks, if it's the body practicing, and we get to know when to go on. So alhamdulillah, then that the this other mom was a second time mom, and she, mashallah, she just she really didn't need much because mashallah she knew she had taken my classes. I don't think she took the refresher one. Yeah. And mashallah, that was again, it happened very smoothly, and I got to know after the baby was born. It was amazing, even more amazing than her first natural birth. And then one very special mom that happened the next day. Oh yeah, after the VBAC and the VBAC after 2 C-section, the next day, a very, very, very special mama, someone I'm emotionally attached to because she had a stillbirth with her first one, subhanallah, may Allah protect. And now she had her first baby, second pregnancy, first baby. And there were some decisions that needed to be made. And that was a moment of high emotions for me as well, alhamdulillah. But she had a healthy baby, alhamdulillah, Allahumma barik. And she's the one who took the classes with me with her first birth, and then a refresher class I offer the ones that have taken classes with me with her second birth as well. And then we move on to the last 3 days. It's been a roller coaster for me, alhamdulillah. I think right now I'm functioning on 2 to 3 hours of sleep, but I love it. I don't mind because I'm on a birth high. So I had a mama, she hired me as a virtual doula. So I was with her literally on call. And yesterday I was telling one of the moms, or on my weight loss group, so I have all these support groups, that I didn't plan to, but I wanted to, but I was kind of forced to because she was on call with me. Had I gone into the lift, the signals would have dropped. So I climbed 5 flights of stairs just so my call would not disconnect, and I would be with her. And then I had a school meeting at that same time, and I made sure that whenever I was going into the teacher, it was during the time she wasn't on call with me. So my meeting was kind of more organized around the mom than anything else. Alhamdulillah, she was blessed with a baby girl. It was mostly baby girls, mashallah. I think there was one baby boy. Yeah, mashallah. Alhamdulillah. And then there was another mom for 2 days. She was in labor. There was a lot of ups and downs with her birth because water broke, head was high, there was some fever. There was a talk of C-section all of a sudden because the baby wasn't doing okay. But then, alhamdulillah, she had a good birth team. Some of my amazing doula colleagues were with her in Lahore. They helped her. And alhamdulillah, mashallah. And her husband was amazing. He was constantly in touch as well. And mashallah, alhamdulillah, mashallah, she gave birth yesterday. And then last night, I got 2 messages. I'm losing count. I think I've got the right number so far. I got 2 messages from a mom here who I was supposed to join in the morning. I was like, yeah, I don't think you're giving birth that soon. All seems good. I'll see you in the morning after I drop my daughter. This, mashallah, I get a message in after Fajr, after like an hour, when I woke up to send them off to school, that mashallah she delivered. So I missed the blessing of being with her, alhamdulillah, but she had an amazing birth. And she herself said that, I posted about her on my Instagram. And then this mom who traveled from the UAE to Pakistan, because like I noticed that sometimes moms have more flexibility in some countries. So she was there, and her sister signed her up. And then her sister is also taking my classes. It's one amazing family that I just got emotionally attached with as well. So mashallah, she gave birth this morning. So it was one back-to-back birth this morning. So yeah, this is why I'm here, alhamdulillah. A brief snippet of the birth stories. Okay, let's breathe and move on to our questions and answers. What I'm going to do is I'm going to actually show you what questions I've had. I'm going to stop sharing my screen and go back to sharing the questions and answers. Here you go. at any point you want to add, so you can just scan this QR code that you see on the screen right now, or go to slido.com and enter this number if you want to add any more questions right now as we're talking. Okay. And I'm going to try and answer as many as I can. But as you can see, some of you have voted. You can vote on a question that's same as yours. So I'll give priority to these questions. All right. So the first question, which I put up on the post as well, how to increase milk supply for a new mother. All right, let's start. Milk supply. Breastfeeding is all about demand supply. Subhanallah, first of all, have faith in your bodies. Our body was created to carry these babies, to birth these babies, and then to breastfeed. I'm not going to go into technical details because that I explained in the classes, but as pregnancy is progressing, after 26 weeks, your body has enough prolactin hormone, which is a hormone responsible for breast milk production, that if, la samahullah, God forbid, someone has a preterm baby, this mom will be able to breastfeed that baby. Subhanallah. All right. So as you approach birth, the level of this hormone is highest. And what do we need to do? We need to nurse the baby. We need to lactate. We need to make sure that the baby gets the stimulation going on according to what the baby needs, right? It's happening as frequently as needed, basically. Okay. Second. All right. So this is the breast model I have that I always use for my teaching purposes. I hope you all can see my video. As the baby suckles, right, it's stimulating the breasts, and it's stimulating and triggering another hormone called oxytocin, which helps with the release of the breast milk. So all of these working together helps increase your supply. So as long as you're stimulating and nursing frequently enough, and I'll tell you in a bit what is frequently enough, you're going to trigger your supply. You're going to increase your supply. You're going to be able to relactate if your supply has dried up. You're going to be able to induce lactation for someone who's never been pregnant or never lactated, but they stimulated their breast with a breast pump, perhaps. Maybe they adopted a baby. I have helped such cases as well. And subhanAllah, it takes consistency, but those moms have been able to produce enough breast milk to give it to their child. All right. So key thing is stimulation on the breast. The more the baby nurses, so if the baby is latching, that's the best thing. You put the baby onto the breast and you let the baby latch, not nurse. On demand. You will not see the milk, specifically new mothers, because this question was new, right? A new mother, she will not see the milk flowing. It's not that she's squeezing and something's coming out. That's not going to happen. But the baby is going to get everything it needs, especially the first milk, which is known as colostrum. You won't actually see it, but the baby's going to get it. All right? Then you nurse on demand. You breastfeed, breastfeed, breastfeed. Every time, whether the baby, you've just nursed the baby 15 minutes ago and the baby's asking again, okay, Adi, just give it again. Because the babies have a tiny, teeny, tiny belly. And I have a belly model here, which I'm going to use. So the baby's belly is very small and it fills up fast. So the baby's belly is that small. It fills up fast and empties fast. And I have a detailed breastfeeding workshop coming up, by the way, next week on the 5th of, so basically next Monday, inshallah. So stimulate either by the baby's mouth or with a pump, and do it frequently. All right. The more frequently you would do it, that is how you increase your milk supply. At any point you're giving a bottle, you're automatically telling your brain, that's that hormone producing your glands here, that breast milk production is not needed. Okay. And then the body goes like, oh, okay. Then the milk supply goes down, and then the baby's crying, and then you give another bottle, and then the milk supply further goes down, and it becomes a vicious cycle to come out of that. So at any point you want to increase your milk supply, nurse, 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 nurse. There is no pump like the baby's mouth. So best is if the baby's latching, let the baby latch. Do lots of skin to skin, direct skin to skin. Okay. with the baby. So baby in diaper, mother's topless, put the baby on you, cover up with a blanket on top. Direct skin to skin really helps. I feel it's something very underrated. So nurse, nurse, nurse on demand. And then, what do you call it? Breastfeed, breastfeed, breastfeed as much as possible on the fact that, one second, let me just give this lady. So breastfeed on demand, even if you just fed 15 minutes ago, the baby wants again. If the baby's staying latched on for too long, adi, no problem. The more there is stimulation, the more the breast milk supply is going to increase. Okay, there is no rocket science. Plus, empty breasts make faster milk. If you're like, oh, but I just fed and it's not full anymore. I'm sorry, that's not how breastfeeding works. It's not a cup that empties, right? It is constant production happening. Okay. Next question. Hang on. Okay, so the next question is how to see cervical dilation. I don't want to go to the hospital too soon and don't want vaginal exams. Okay, so cervical dilation is very different. It's very much inside and you can't really see it. Okay, so this is our pelvis. All right, this is the pelvis. The baby is going to be descending through it, and the cervix is up here. It's at the opening of the uterus. It's the doorway, and this is why we have labor, to help open it up. Okay, so you can't just peek and see it. You won't. Yes, we want to avoid any sort of internal checks and vaginal exams. That's not recommended because it increases infection risk. It can sabotage the oxytocin, which is helping labor to progress. Lots of implications. So, how to see cervical dilation? Do you really want to see it? I mean, the only way really technically is to check it. There are some studies of a purple line, or we call it the rhombus. It's like a little lump that comes up because of the bones opening up as the baby descends. Some studies show that it could be an indication, but it's not very evident on some women. It's on her hip side. I have yet to see it to be very curled, so I would not go with that. It's not very trustworthy method. But my point is, and I learned this from the teacher I took classes with, that why do we want to worry about progress? The fact that you're having contractions and eventually those contractions are going to turn into pushing stage, that just means there is progress. Even if there is no measure, it's not measurable. And dilation is a tiny tip of the iceberg. There's a lot more happening, which is not measurable. All right. And many women get disappointed by, oh, okay. And that is, subhanAllah, one of the stories, the mama who had the VBAC. That is because she thought she was ready to give birth. And when she goes, she's like, oh, okay, it's only 4 centimeters. I still have time. And she got discouraged. And we need to remember there's a lot more happening than just dilation. There's, what do you call it? There is the effacement happening. There is alignment happening. There is the baby descending. There is other things which we really can't measure. Okay, so we need to keep this in mind, that dilation is not something that will tell us only the progress. So time your contractions, labor, stay at home until you reach the pushing stage. Educate yourself, please, because I cover these stages over 3 sessions in my classes, and I teach 10, it's 10 sessions, and this detail is covered in 10 sessions. So please make sure you're very well informed and you know what signs to look for. And you can totally skip it. If you don't want vaginal exams, that's totally fine. Respect your space. Okay? All right. Okay, this is answered. As a mother with no breastfeeding experience, I was always confused if milk is coming when my baby's latched on. How do we know without peeking it again? I answered this. You will not see the milk flowing. You're going to, just the fact that the baby is staying latched on. If the baby is not staying latched on, that could be an indication. Second thing is, the best way to make sure that your milk supply is good and the baby's getting enough is diaper count. Now, I don't have a newborn, but I have a newborn diaper. Wet diapers. We want, after the baby is 1 week old, we want 6 wet diapers. as long as the baby's producing and one wet diaper is not soaking wet that you haven't changed in 5-6 hours and the baby it's ready to burst. Nuh-uh. 3 tablespoons of water is equivalent to 1 wet diaper, and we want 6 of those. As long as your baby's producing those, I think just trust your body, know that the baby's getting what it needs. What is a good gap for a VBAC after 2 C-sections? 24 months between births. Okay, this is very textbook. Having said that, there are moms who've achieved VBACs with 13 months gap between births. So they conceived when their second C-section baby was basically 4 months old. There are moms who've achieved VBACs with 11 months gap. Don't do it blindly. Be very well informed about danger signs, all of that. Okay? So 24 months. So basically 24 minus 9. So when your second C-section baby is 15 months old, then you can start planning, inshallah. May Allah bless you with a VBAC after 2 C-sections. How long for delayed cord clamping? Minimum is 1 minute. Now WHO recommends 3 minutes. Ideal, the best, is until the cord stops pulsating. So I do have a cord as well. So my old baby, which is a bit messed up, but this is the cord, the umbilical cord that is attached to the baby. Once the baby is born, it should not be clipped and cut immediately. It still has a third of the blood volume that the baby needs. It's still a lifeline, the baby, until maybe it needs some suction. The baby just needs some time. So the baby's still going to get all this oxygenated blood, iron-rich blood, lots of stem cells. So ideally until it becomes white and limp. Okay, it stops pulsating, white and limp. Usually that happens within 10 to 15 minutes. Okay. My husband doesn't know how to support me in pregnancy and birth. You feel lonely and you want his support. May Allah ease this for you. Best thing that you can do for him is let him come with you to the classes. If sitting through my long live sessions is difficult, and remember, my sessions are recorded. So those of you that join my classes, the session itself is recorded, and you have access for a year. So let him sit with you in the classes. So leave the how part to me, because husbands do want to support, most of them. They just don't know how to. And we expect things from them. So we need to get this relationship kind of working in this new phase of life as well. And then part of the classes is a parent journal. Parent journal, not mama journal. It's a parent journal, which consists of 172 pages. And it has activities that you do as a couple. And those actually help with the communication as well. Really effective. I love doing them. And my husband loved it as well. Plus the Amani birth classes, again, why I love Amani birth. Once you sign up, you'll get a login and password. And you'll get these short videos that you're expected to watch between the week I see you. So our classes are weekly. So for example, I will see you every Sunday. Okay. So from Sunday to the next Sunday, you have this time to watch these short videos. They don't take more than half an hour. So make that couple time, just like you sit and watch TV perhaps, or do something perhaps. So just sit together, half an hour, we can definitely take out in a week. So those brief videos are usually more than enough as well. Okay. And then if they join my live sessions, salute to those husbands. Thank you very much. Alhamdulillah. Okay, wait, let me see if there's something I need to miss out here. All right. Please give tips on do's and don'ts on breast milk pumping. I love this topic. I have been an exclusively pumping mama, by the way, for one of my babies, due to very detailed reasons, which I'm not going to go into today. But I love pumping, and this is kind of my specialty as well. So with my colleagues and stuff, any pumping situation comes to me. I have support groups, WhatsApp support groups on pumping. Subhanallah, that's how much I loved it. So if you're doing it combined, so for example, you're going back to work. I do have a detailed 2-hour workshop on pumping only, by the way. So if you're going back to work and you want to pump, so you want to start at least 2 weeks before you go back to work. Try to pump just 10 minutes after each feed, so that you're not kind of disrupting and you're not overstimulating your breasts as well, because more stimulation can result in oversupply. And while that sounds nice, it's not the best, okay? Because it comes with its own challenges of mastitis and clogged ducts and pain and okay? So 10 minutes after each feed, you want to pump, and then combine the milk. Keep it in the fridge, combine it, and you can keep it's good in the fridge for up to 4 hours. At room temperature, it's good for up to it's good in the fridge for up to 4 days. At room temperature, it's good for up to 4 hours. If it's the freezer on top of the fridge, it's good there in a breast milk storage bag. Don't do bottles in the freezer because those are pre-sterilized and you can remove air. Air kind of elongates the life of anything in the freezer if you remove the air. So freezer on top of the fridge is good for up to 6 months. If it's a deep freeze, it's good for up to 12 months. But do the FIFO LIFO method, right? First in, first out. Use the older one first. Okay? And if you're going out, what I used to do, I used to have my little insulated bag with ice packs. I would keep the milk if it's freshly pumped in there. Or if I was taking frozen milk, I just let it thaw while I was out. And thawed milk should be in the fridge and used within 24 hours. If it was outside, the same rule of 4 hours apply. I do have a post on my Instagram. Let me see if I can pull it up and show you guys on breast milk storage guidelines. And those of you that attended my workshop and are going to attend, inshallah, I'm going to be doing another one. Probably got a magnet on it as well, a fridge magnet to stick on. All right. Hang on, let me, yeah, there you go, I found it. So let me quickly switch the screen sharing and show you which post I'm talking about. So, yeah, there you go. So this is the one. Let me just click it and pull it up. There you go. So this is breast milk storage guidelines. You can find it on my Instagram. Save it, so it's just there as a reference for you to pull up anytime. Okay? So room temperature, refrigerator, freezer, deep freezer, insulated bag with ice pack, especially if you're pumping at work and you need to bring the milk back home. It's good in it with frozen ice packs, frozen overnight for up to 12 hours, so 24 hours. Thawed milk in the fridge, like I just said, and unfinished milk. If the baby's drank from the same bottle, the bacteria from the mouth goes into the milk. So you want to keep it in the fridge and use it within 2 hours. Okay? So yeah, I just wanted to show you guys that. And let's go back to our questions. Alrighty. Okay, so this one's done. During doctor shopping, what questions should I ask the doctor in the first meeting to determine if she's supportive or not? Try to have a birth plan ready before that, so that you know exactly what you're looking for, right? And don't present the birth plan in the first visit, no. But try to and ease it in, butter them up, put them on that pedestal that who has been supporting me. And have your priorities. What are your top 3 priorities for your birth? Ask those first. For example, for me, it was I needed a VBAC. And yes, if I shopped 18 doctors, almost 16, 17 of them said no. And what did I do? I talked with my feet. I walked out. And I kept shopping because I had the right knowledge. I did not let anyone tell me otherwise. And I badly wanted. If you badly want something, you will leave no stone unturned with the right knowledge and not going crazy and, any sort of extremes. Okay? So put them on that pedestal. Take top 3 priorities of yours. In the classes, session 7, it's a whole hour and a half, 2-hour module where I actually give you a list of questions to ask. I can't share that list here because obviously copyright to Amani Birth. But ahlan wa sahlan, welcome to my classes. Inshallah, you'll get it there. And we do write our birth plan. So in session 9, I'll actually spoon feed you and help you write that birth plan. Just yesterday, was it yesterday, Rabia? I received one of the most amazing birth plans, mashallah, Allahumma barik. I was so impressed by the words and the way she structured and the convincing words that she used. So I did teach her that. Okay, so mashallah, alhamdulillah. So you should know your birth plan memorized, kind of. And then the top 3 parts of it, ask those. If she doesn't seem to be supportive, if she's not listening, if she's dismissing you, demeaning you, bye. I can move on. Okay? All right. Let's move on to the next question. What's the best way to achieve natural birth when the doctor and hospital not favor it and you can't afford to change them? Labor at home. Be well informed yourself. Labor at home. Go last moment. if all is well, keeping a check on yourself and the baby. For that, you need to be well informed. And that's exactly what happened with my mom, who had a VBAC after 2 C-sections of 13 months gap. She was not finding anyone supportive. And she literally, during labor, ready to push, went to one hospital. They refused to take her. She went to another one. And alhamdulillah, she gave birth. So don't think you need anyone's permission. Change your mindset. It's a lot to do here. You don't need anyone's permission to tell you what you or you can't do. It is when we start feeling inferior and we let them be the superior, that's when they will say anything and do anything. So I was just reading one of my friend Lana. Some of you might know her. Her baby wearing support group, and she's a birth worker here as well. She had amazing births. Last one was home birth as well here. She had a home-like hospital birth with her fourth baby as well, mashallah. She just shared something very nice, which I saw on Instagram today. Set the scene. Show that you're in charge, right? That confidence, your knowledge will give you that confidence, okay? All right, 18-month-old baby, exclusively breast. He keeps on wake up during the night. What should I do? So he sleeps through the night. He eats everything and has a full stomach before bed. High protein food before bed. He could be going through a growth spurt or teething at this age. So it could be that which is irritating him. Let someone else put the baby to bed, right? Sometimes they just know that this is easy accessible because it's 18 months old, right? It's not a baby that needs breast milk every hour. Okay, so let someone else put the baby to bed. You can just for a week or something. And that is one of the methods of gently weaning, working towards gentle weaning as well. Okay. See, maybe the baby wasn't well recently. Maybe they're coming up less hello with something. Offer something, offer water. Don't offer the breast milk. Okay. And communicate. 18-month-old babies do understand. So communicate. Tell them you're a big boy. Praise them. Yeah, that would work, inshallah. What to do if breast milk doesn't come in right after birth and doctors suggest formula? Can I express colostrum? Yes, you can do colostrum harvesting. Doctor suggests formula and breast milk doesn't come in. Breast milk's always there. Breast milk's there when you're 26 weeks pregnant. Our knowledge is the one that is lacking. That's what I believed as well. What you just wrote is what I believed when I had my first baby, my first C-section. It's alhamdulillah for the knowledge. Alhamdulillah for the what I learned. Basically, I managed to have the right information to be able to understand how this whole mechanism works. Okay? So it's very important for us to understand and have faith in our bodies and know that you're not going to see it, but it's there. And just keep latching the baby on. Do not send the baby to the nursery. That's the first mistake many do. So the baby's with you, nurse on demand. Okay? Do not give formula because then, especially if it's being given with a bottle, it can increase the risk of nipple confusion. And we don't want that as well. Okay? And for colostrum harvesting, you can hand express, but don't do it before 36 weeks to reduce the risk of preterm labor. Okay? You hand express. You collect it in tiny syringes and you freeze it, and that can be there. Okay. What should I eat to increase calorie content of breast milk? Continue your pregnancy diet. We often fail on doing that. So no junk foods, healthy fats, nuts, protein, seeds, fish, meat, healthy beans, lentils, grains, all of that, inshallah. Okay, the minimum waiting time for a second birth after C-section if I get pregnant with minimum, like I said, there's no minimum. Like I just told you guys the story, so this one's been answered as well. 2 weeks postpartum, had to give baby formula because of inverted nipples. He wouldn't latch. Pumping while also face slowing supply. How do I cope with this? So inverted nipples doesn't mean the baby cannot latch because it's breastfeeding. Where is it? It's breastfeeding, not nipple feeding. So this is a breast model of an inverted nipple. Okay. The baby needs to take on a good part of the urola. So you need help with latching to see someone in person wherever you are and get in-person help to let someone help you with the actual latching. Okay? And frequent stimulation, yeah? Reduce the bottles to avoid nipple confusion. Episiotomy. Sitz bath with Epsom salt. patsicles, so cold patsicles, Kegels, very, very helpful. Sitting under like a ring cushion, that is also very helpful. These are the key things. But the patsicles, like the cold, you can make it yourself, or witch hazel, you can pour that, or witch hazel pads. Those are really helpful. Let it air dry as well. Sitz bath is like a little tub, you can sit in it, or if you have like those jugs, lotas, you can make the same thing and use it for that as well. Okay, and keep it clean, pat dry, and change your pad very frequently as well. Uterine scar thickness is not a decisive factor for a successful VBAC. I've had a case of a mom whose scar started to separate even though the scar thickness was ideal. And then I've had moms whose scar thickness was way low, 0.9 mm, and she had a long labor of 4 days and she was fine. So yes, it's not a decisive factor. Okay, you need to be well informed about the warning signs. Is collecting necessary? It's not necessary. Like I said, you can just breastfeed your baby. Same goes with pumping. If you're not going to be working, your baby's with you, you really don't need to pump as well. That's if your baby is separated, then you might need to. The best thing you can do to prepare for your breastfeeding journey is join the breastfeeding workshop. That is really the best thing that you can do for yourself. 6-month-old expresses for naps and night. She refuses to put down and pacifies on the breast. Okay, so do sideline. Yes, it's completely normal. Sideline. Lay down on your side and let the baby be latched on, and you get sleep and baby gets sleep. That works. Okay. If X-ray is the only suitable option to check if the pelvis bone is narrow or not naturally to let the baby pass through, shall we do it or not? I would be running far away from any obstetrician or care provider who's suggesting an X-ray in pregnancy. Speak to a radiologist and they would say a big, big no. It is not safe. Full stop. If it's necessary, it's not. If something's not safe, how can it be necessary? No X-rays in pregnancy. Zip. That's it. What should we do before planning a second pregnancy, especially for a VBAC? Okay. You have had hyperemesis and a breech baby. So breech baby is very unpredictable. You can. So I would suggest as soon as I would work on your diet. I would work on being active daily, regular exercise, check for deficiencies, and take care of your dietary needs. Hyperemesis is something usually due to a deficiency. Look into magnesium-rich foods and stuff. Work with a functional nutritionist if needed as well. All right. And as for the positioning and the alignment of the baby, please, 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 exercises of pregnancy, don't wait until the 3rd trimester. That's one of the biggest mistakes many do. Day 1 of pregnancy. So as soon as you know that you're expecting, please sign up. Can we do at our own? Yeah, of course you can. Nipple cracks and pain is not normal, and it happens when there is a bad latch. And a bad latch is not normal. So all of this you can do yourself. If the latch is bad and you're having cracked nipples, please see a lactation professional ASAP. Immediately. You putting the balm and healing it, that's just putting a band-aid. It's not addressing the cause. Okay, I talked about inverted nipples already. That's fine. That's pigmentation, no problem with that. If there's peeling, it's not dangerous for the baby. 40 plus 3, no pains. Doctor said to induce tomorrow. And this question came when? So probably today. 40 weeks is not a deadline. Your baby is not Cinderella's pumpkin that's going to turn into a pumpkin at the stroke of 12. I've had mamas give birth, gestate up to 44 weeks if everything's fine. Every child develops differently inside. My reason for that unnecessary C-section 16 years ago was this, because I was uninformed and I went in for that induction. And obviously, of the last, I was talking to somebody, I think it was Anna, of the last 8 or 9 induction cases, only one of them I think proceeded, or even if that did or not. The rest of them, I all ended up in C-sections. So induction, yes, I know a few that did end up successfully. Mashallah, I've shared a few of those in my story. Those were rare, that's why I shared. But most don't end up that way. Okay. Feeding till that's fine. The baby cluster feeding, especially in the night, because the melatonin helps increase oxytocin, which helps increase the breast milk supply. So that's completely fine. Nothing to be concerned about. Babies really don't know the difference between night and day yet. Do I need to take classes if I'm following up with a doctor that is supporting natural birth? Okay. Doctor, how much is the doctor going to be with you during the labor? And first find out what is their support for natural birth. Ask them. But how to know what to ask and what to know whether it's a routine procedure? Is it medicalizing a natural event? Because birth is a natural event. And if we over medicalize it, we're going down. So for that, yes, you need to be informed so that you are able to labor at home. You are able to give your body the nutrition and exercise, everything it needs in pregnancy. Okay? So yeah, rethink this question, pray istikhara, and then decide whether you want to educate yourself or not. Yes, this is being recorded. Okay, I think, mashallah, the questions keep coming up. Let me see quickly. I think we are done with all the most famously voted questions. So we're just down to the two. So, and I'm looking at the time as well. Nursing on demand for this one. Postpartum care routines. In the classes, the last session is all about postpartum. Okay. That's a very sweet one. I love you, Hafsa Baji. Thank you. Please tell everyone to educate and take support for that. So yes, please everyone, listen to her. You do want to get that support. I don't want mamas to feel alone in their journey. Okay, so please, please, please sign up. I wish I could give free support to everyone in the world, but obviously I'm a human. Come on, let's respect and value. When we value our knowledge and we're ready to invest in it, only then will we benefit from it properly. Okay. Clog ducts, important. When both are lacking, emotional support or hospital facilities. Yikes. Okay, you definitely need then the virtue support at least. Feeling sick or tired all the time, please get checked for deficiencies. Subhanallah, there are so many questions. There's like still 33 that I haven't answered. I need another hour or two. The last question, how to take care of the pelvic floor. Please join on Wednesday with Anna and I. So I do these enriching talks every month. This is going to be episode 9. The rest of the episodes you can find on my YouTube, and I'll share my links of my channels and everything on the 2 event groups. So she helped me with my pelvic floor and my healing postpartum and everything, and diagnosing my diastasis and all of that. So yeah, you don't want to miss the free live session on Wednesday with me. It's going to be on Zoom, not on this platform. I'll share the link of it in the group. If you know anyone else that can benefit, please add them now and don't leave the events group. When to visit the hospital, time the contractions, educate yourself, please. Okay. All right. I think I would need to end this here. Let me see quickly. Any other ones? Anyone with high blood pressure, preeclampsia, please look into homeopathy remedies. Very effective. IUGR history, work. We need to see why. There is always a reason behind it. We need to see why. Work on it from day 1 of your pregnancy, please. It's a lot to do with your diet. Yeah, I would not do manual removal of the placenta. Okay. You can check if you want more positive stories about VBAC after 2C. You can check my Instagram, the one that had it last week. Mashallah, she was very quick in sending me her story. And it was so beautifully written. Subhanallah. I've been too much on my plate to be able to post it yet, but it's coming up soon. Inshallah. If your newborn latched very tightly, they could have an oral restriction. So there's things like lip ties and tongue ties and body tightness. So you need to work on that. Okay, so you need to look into that. And use of nursing pillows to help with nursing positions, right? To help support the baby. So that's not you going to the baby, rather you're bringing the baby to you. Okay. Reason for emergency C-section at stage -3 and stage 0. So stage 0 doesn't mean the baby's coming, like the station. That's one measure. what position were you in, right? Yeah, we need to see what other reasons. 7 months postpartum to take 5-day trip with my husband while leaving my child behind. So how to boost my supply at 7 months postpartum to take a 5-day trip with my husband. Pump, like rigorous pumping. Add power pumping into your routine so that you have built enough storage so that while you're away, the baby has breast milk. Okay, and start doing that at least a month in advance so that you have enough for 7 days. And while you're, for 5 days, and while you're traveling with your pump and you're pumping frequently, not the pump, but at least every 3 to 4 hours. A 7-month-old baby, they would be talking solids as well. So you could pump every 3 to 4 hours as well. And then you can bring the milk back. So maybe booking a hotel. I think I did a session on traveling and breastfeeding. If not, I should do one. Yeah, I think I did. And then bring the breast milk bag with you, with the proper storage and stuff. Yeah, I've done that. I've traveled a lot with pumping and stuff. If you want to, yeah, by the way, I do one-on-one consultations. At any point, anyone wants to book a consult, I'm fully booked for this week, but the next option is Sunday, which I think might be booked already. So Monday. So I do online consultations if it's a specific thing that you want to discuss. Okay, I think, yeah, I do want to answer all of them, but may Allah give barak in all of our times. Okay, let me go back to sharing our slides again. Alhamdulillah. All right, Jazakumullah khair for tuning in, and we've done the birth stories. I just want to tell you about the classes. So this is the birth preparation classes that I teach. Next group, I'll tell you in the next slide. So it includes pregnancy nutrition. So it's like you can see here. It's got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 modules, 10 sessions basically. Pregnancy nutrition, pregnancy exercise, pain management methods, mother's needs in pregnancy and birth, birthing instinct, making informed decisions, right? Birthing positions, like for labor and birth. Doctor shopping tips and tricks, whenever you have that question, and birth team shopping, I would say. Stages of labor, role of hormones, how to manage your labor, writing your birth plan, birth team roles, what should your husband be doing, what should your doula be doing, what should your care provider be doing. And a care provider can be a midwife or a doctor, by the way. A doula cannot birth your baby, keep that very clear. Protecting your birth environment, because that impacts the flow of our hormones. How to make labor easier, yes, you can. And then we do cover complications, true complications and common interventions, la samhallah. And then postpartum needs, whenever you ask. So postpartum needs, newborn care, and breastfeeding is covered in this. And then me being a VBAC obsessed person, I have a free VBAC module for moms looking for natural birth after C-sections. It's an added on component. That's why my classes, sorry, excuse me for all those that have taken classes with me know that, but my classes usually are much longer than they should be. So apologies in advance, but there is just so much I want to share, but I will try to stick to time, I promise. Well, I'm not going to promise, but I will try. Okay. Sorry, I skipped one. No, I didn't. This is one testimonial of a couple. So this husband and wife, they joined my classes recently, and I absolutely love what they both wrote. Okay, enrolling this course was one of the best decisions we made as first-time parents. We initially felt overwhelmed and uncertain amidst the noise around us, the family noise, the medical noise, all that noise, and our own lack of research-based knowledge. This course helped us to navigate the wonderful journey of pregnancy, childbirth, and breastfeeding with deeper understanding. It reinforced how important childbirth education is for parents, and then they took the classes with me. I was their course facilitator, and alhamdulillah, they found me to be, I'm not going to read it because it's then praising myself, so you can read it yourself, right? But yes, I do address all your queries. It is definitely a judgment-free zone. If you go in for a C-section, I'll hold your hand through that as well, okay? And alhamdulillah, it was a very reassuring, empowering experience for them, okay? And this is all that's included. So the classes, 20 hours, and now it's 25 hours of comprehensive education because of my timings. There's a WhatsApp online support groups, extra resources after each session, pregnancy exercise videos, how to do each exercise, nutrition guidelines, recipes, as well as I actually go through individual diet charts, emotional debriefing, of course. The live sessions are interactive with my video on, with my props and everything. So because visual, as adults, we are visual learners. right? So I'll demonstrate with the props, and the access for it all is for a year, right? And then, like I said, the VBAC components included. Postpartum guidance is there because I'm a lactation professional. So if anyone has any breastfeeding related queries, they can always come to me on my groups. Okay, and the price is specially discounted. It's available in English, it's available in Urdu, and it's available in Arabic. All right, and it is the best Islamic faith-based program. Next group's coming up is May, which is what? Today's Monday. 2 days. 2 days later is the next. No, 3 days later. On Thursday is the next group. It's the English group, and I think it's full. I just had one registration this morning, so I think one seat's left. I might add a couple more seats, but yeah, sign up ASAP. And then the next one after Eid is the Urdu group, and then there's no group until August, September because I will be traveling. Okay, so you don't want to miss out on those. And these classes last for 5 to 10 weeks, so don't think that I can just join on the day. It doesn't work that way. Another beautiful testimonial. I like this one because it's got these little hearts. I'm glad to have joined this course that has empowered me with evidence-based. So there's knowledge out there. You can search YouTube, you can Google, you can ask GPT uncle, right? But evidence-based structured knowledge is the key thing, right? That birth is not something to be scared of. I want to eliminate the fear of birth from each one of you, inshallah. It's rather a beautiful and empowering experience, especially after joining the community I have created, Hafsa has built, where many mamas now advocate for this kind of birth. So it's like like-minded people supporting each other, even if it's ended up with a C-section. She loved the live sessions and the friendly atmosphere. Yes, very interactive, very friendly. And I absolutely love teaching it. It comes out from passion. Okay, and yes, I do definitely very dedicated, and there's alhamdulillah, it's all praise to Allah, not me, that there are, alhamdulillah, like I said, 9 success stories in the last 2 weeks. Alhamdulillah, it's been raining babies. This is the workshop I'm talking about. May 5th, it's going to be the same time, Monday, next week. Okay, so this workshop is called Breastfeeding the Right Start. It's a comprehensive 2-hour workshop on breastfeeding for pregnant moms, for newly postpartum moms as well. Okay, and you can message me to register for this. And these are more things. This is a leaflet I made. I just put it up here. So these are other specialized workshops. So all those of you that take classes with me, you get discounts for my workshops for a lifetime. Okay, so there's this breastfeeding. I've got the pumping, powerful pumping workshop. I've got the newborn care, baby basics, especially for first-time parents. Increasing your milk supply. I have a specialized workshop on this. In Ramadan, I did an amazing Ramadan workshop, which had an amazing support group. And I absolutely love that group, alhamdulillah. VBAC after a C-section, if you don't have time to do the whole course, if you're like due soon. Starting solids, toilet training, weaning from breast milk, baby-led weaning, which is a method of starting solids, writing your birth plan, and labor preparation. Okay, and then this is the next free event. So this week, basically, today we have this. Wednesday, we have this session with Anna. This is my Enriching Talks episode, 8, not 9. On C-section awareness month, because April is about to end. I managed to grab her thanks to Anna. On before, during, and after. So tips for smoother recovery, scar care, healing, and she's got like 13 years of experiencing specializing in prenatal and postnatal care and the pelvic floor health, right? So she's got like I said, she was my PT, and I really benefited a lot from her as well, alhamdulillah. So she's agreed to do it. I think she'll be joining all the way from Spain, if I'm not wrong. So yeah, please join then. It's a free session. And this one, I think I'll put today's as well on my YouTube. So it's all there for everybody to watch. Okay, and thank you. You can scan this code to join my WhatsApp, or you just go to Hafsa KQ. These are my contact details, my email. I think that's it. And thanks to Amani Birth for providing such amazing classes available online, global moms. Alhamdulillah, I'm thankful to Allah subhanahu wa ta'ala for all of the mamas that come into my life and trust me to educate them and join me in this. All right. And one last testimonial. I liked this one. That's why you can find the QR code on this screen as well. I just want to express my heartfelt gratitude for this amazing course. She was blown away by how empowering and reassuring it was. And as new mamas, isn't that what we want? Even if it's your 5th baby. Every pregnancy and birth comes with its own journey of challenges. To be honest, she was terrified of giving birth at first, but this class transformed her mindset, alhamdulillah. The way it presented everything in such a natural and calm light put your heart at ease. Birth doesn't have to be chaotic. She felt confident and prepared, knowing that she had the right information at her fingertips. It's truly a one-stop solution. You don't need to look anywhere else after that. And alhamdulillah, she thought of me as her angel. Yes, every single mama of mine is like a sister. I will take care of you. I will support you, and as much as I can, alhamdulillah, inshallah. This is my purpose of life, and this is my passion. So it really comes from in there. I'll stay awake and give the support if I need to. All right, and she's thankful for creating such an incredible resource. She feels like a weight has been lifted off her shoulders, and she can look forward. One of my mamas, she's a VBAC after 2C in India. She said, I'm looking forward to my labor pains. I was like, are you sure? I was laughing with her, but mashallah, she said like, and alhamdulillah, her birth went amazing. She had a home birth. Mashallah, alhamdulillah. All right, that brings us to the end. I am sorry if your question was not asked, but yeah, time. May Allah give barakah in our times. Thank you everyone that joined. Jazakumullahu khairan. And I will share the recording of this session, as well as I'm going to share all my channels. And if anyone wants to register, please just DM me now as soon as possible, and I'll get back to you as soon as I can. All right. Subhanallah wa bihamdihi, subhanakallahumma bihamdika, nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk. Jazakumullahu khairan. Inshallah, this was beneficial. Thank you everyone who joined. Assalamu alaikum wa rahmatullahi wa barakatuh.